As people grow older, many of the small daily habits that once came naturally begin to fade quietly. It starts subtly, skipping a shower one day because it feels too tiring, or forgetting to brush teeth before bed because the evening routine was interrupted. What seems harmless at first slowly becomes a pattern that doctors notice almost immediately. In elderly care facilities and home visits, healthcare professionals often find that these small hygiene lapses can lead to serious health problems if not addressed in time. One of the most common mistakes among the elderly is neglecting regular bathing. The reasons vary: fear of slipping in the shower, discomfort with cold temperatures, or simply reduced energy levels. However, skipping showers allows bacteria and dead skin cells to build up, leading to unpleasant odors and even infections like dermatitis or fungal growth in skin folds. Doctors immediately recognize the telltale signs: dry patches, redness, and small rashes that signal a lack of proper hygiene. Another issue doctors often observe is infrequent oral care. Brushing and flossing may seem simple, but for many seniors with arthritis, tremors, or memory loss, it becomes a challenge. The result is not just bad breath or yellow teeth. Gum disease and tooth decay can trigger infections that spread to other parts of the body. Some elderly individuals even stop visiting dentists altogether, unaware that poor oral health can increase the risk of heart disease and stroke. A third mistake that often surprises family members is wearing the same clothes for days or even weeks. Many seniors don't realize how quickly bacteria and sweat accumulate in clothing, especially undergarments. Doctors can spot this instantly. The skin becomes irritated, and fungal infections may appear under the arms, breasts, or groin. These small oversights are not signs of laziness but rather of declining mobility, depression, or even mild cognitive decline. But the fourth mistake, the one doctors find most alarming, is improper care of intimate hygiene. Many elderly people, especially those with incontinence issues, fail to clean themselves properly after using the toilet. Sometimes it's because of embarrassment or fear of asking for help. Unfortunately, this leads to serious infections, urinary tract diseases, and chronic skin irritation. Medical professionals immediately notice the odor and the irritation in these sensitive areas, often prompting uncomfortable but necessary conversations with caregivers. Doctors stress that these hygiene problems are not just about cleanliness. They reflect deeper issues like loss of independence, depression, or early dementia. In clinics, they often see that when personal hygiene declines, it's a signal that an elderly person might be struggling to live alone. Many seniors feel ashamed to admit their difficulties, and families may overlook these early signs until a doctor points them out. The key, experts say, is compassion and support. Setting up easy-to-use hygiene systems, such as shower chairs, grab bars, electric toothbrushes, and warm lighting, can help restore confidence. Encouraging dignity, rather than judgment, is what keeps older adults healthy, safe, and self-assured. What doctors see as mistakes, or really cries for help, signals that someone needs more care, understanding, and gentle reminders to maintain the habits that once kept them thriving. Episode 2, Hidden Dangers, What Doctors Want Every Family to Know. When doctors examine elderly patients, they don't just look for diseases, they observe the small things that reveal how a person is living. The smell of unwashed clothes, yellowed fingernails, dry skin, or untrimmed hair often speak louder than words. These subtle details tell doctors that a patient might be struggling with personal hygiene neglect, a hidden danger that can quickly spiral into medical emergencies. One mistake many seniors make is forgetting to wash their hands frequently. Doctors can immediately spot this because it often results in recurring stomach infections or colds. Seniors sometimes skip hand washing after meals, gardening, or using the bathroom, thinking it's unnecessary. However, weakened immune systems make them highly vulnerable to bacteria that younger people might easily resist. A simple habit, ignored too often, becomes a silent threat. Another major concern is improper foot care. Doctors often find neglected toenails, fungal infections, or open sores that the elderly person didn't even know existed. For diabetics, this can be life-threatening, as small wounds can turn into ulcers or infections that require hospitalization. Many older individuals can't bend easily or see the bottom of their feet, making self-care difficult. That's why podiatric visits or caregiver checks are essential, something doctors emphasize strongly during consultations. Then there's the problem of excessive use of perfumes or powders instead of actual cleaning. Some elderly people, embarrassed by odor or limited mobility, use cologne or talc powder to freshen up, without bathing. But this only masks the issue, while bacteria continue to grow on the skin. Doctors recognize this right away and gently remind patients that no amount of fragrance replaces proper hygiene. One of the more overlooked mistakes is using old or dirty towels, sponges, and bedding. These items collect sweat, skin cells, and bacteria, becoming breeding grounds for infections. Doctors often find that a senior's skin rashes or respiratory allergies are not due to medical conditions, but to poor fabric hygiene. Changing towels weekly and washing bed linens regularly can make a remarkable difference, something many elderly patients forget as routines blur with age. Doctors also warn families about poor nail and scalp care. Dirt and bacteria trapped under long nails can spread easily, and untreated dandruff or scalp buildup can cause infections. When a doctor examines an older patient's hands or head, they can instantly tell when grooming has been neglected for weeks. The shocking truth is that many of these hygiene lapses are not intentional. They often stem from loneliness, cognitive decline, or the simple fact that daily routines feel harder with age. What doctors want families to understand is that hygiene neglect is an early red flag, a sign that an elderly loved one may need more emotional connection, professional support, or physical assistance. Maintaining personal hygiene isn't just about staying clean, it's about preserving dignity, confidence, and independence. For doctors, noticing these hygiene mistakes isn't about judgment, it's about offering hope. When an elderly person regains control of their self-care, even in small ways, it sparks a powerful transformation. They stand taller, smile more, and feel human again, because cleanliness, at any age, is deeply tied to self-respect and health. When doctors visit or examine elderly patients, they don't just listen to heartbeats or take blood pressure readings. They observe every small detail, the way a person smells, the condition of their clothes, the cleanliness of their nails, even the state of their skin. These subtle signs tell stories that words sometimes cannot. To a trained eye, a faint odor, an unwashed scalp, or cracked lips are not mere details but indicators of how well someone is managing their personal hygiene and, by extension, their overall well-being. As people age, maintaining hygiene becomes increasingly difficult, not because they stop caring, but because their bodies, minds, and emotions no longer cooperate the way they used to. Doctors notice these things instantly, and what they see often goes far beyond physical cleanliness. It reveals silent battles of loneliness, depression, memory loss, and loss of independence. One of the most frequent hygiene lapses that doctors identify among elderly individuals is neglecting proper handwashing. It may sound small, but its effects can be devastating. Many seniors, especially those living alone, forget to wash their hands regularly after eating, using the toilet, or handling household tasks. Sometimes they believe it's unnecessary, they're not going out much, so what's the harm? But doctors can see the consequences clearly: frequent colds, stomach infections, and unexplained fevers that could easily be prevented. The elderly immune system is already weaker, and skipping such a simple act can open the door to bacteria that younger bodies might fight off easily. Doctors often emphasize to caregivers that consistent hand hygiene is one of the most effective ways to prevent illness in older adults, yet it remains one of the most neglected habits. Another issue that doctors encounter often is improper foot care. It's an area of the body that many seniors can no longer easily reach, see, or feel properly due to poor circulation and nerve damage. Overgrown toenails, dry cracked heels, and fungal infections are incredibly common among the elderly, but what's worse is that many of them don't even notice. Doctors frequently discover small wounds or sores during checkups that patients weren't aware of. For diabetics, such wounds can be catastrophic. A simple blister can turn into a deep ulcer, and if untreated, it might even lead to amputation. When doctors remove a shoe and see signs of neglect, thickened nails, redness, or fungal buildup, they immediately know that hygiene has become difficult or forgotten. In many cases, it's not just carelessness but physical limitation. Bending down or balancing on one leg to trim nails can feel nearly impossible for someone with arthritis or spinal problems. That's why many geriatric doctors recommend regular foot inspections, podiatry visits, and even family involvement to ensure these silent areas of neglect don't turn into life-threatening conditions. Doctors also frequently see the overuse of perfume or talcum powder as a substitute for actual cleaning. Many elderly people, particularly those with mobility challenges or a fear of bathing, start to rely on these products to mask odors. A little spray of perfume, a dusting of powder, and they believe they've freshened up. But doctors can tell immediately that the body hasn't been properly cleaned. The scent of perfume layered over unwashed skin carries a distinct odor that professionals recognize right away. Moreover, powders can clog pores and worsen fungal infections in skin folds, especially in warm areas like under the breasts or in the groin. Doctors often find themselves gently explaining that fragrance cannot replace hygiene. Proper cleaning removes bacteria, while masking it only allows germs to multiply. It's not vanity they're concerned about, it's the potential for infection, rashes, and even respiratory irritation from excessive product use. Then there's an overlooked but very important aspect: the use of old or dirty towels, sponges, and bedding. Many seniors forget to change or wash these items regularly. Towels, in particular, trap moisture and bacteria, and if used repeatedly, can spread germs back onto freshly cleaned skin. Doctors notice this pattern because skin infections and rashes often stem from such sources. Likewise, bed sheets that haven't been changed in weeks collect sweat, dead skin cells, and dust mites. Doctors have seen elderly patients develop respiratory problems or allergic reactions that are easily traced to unwashed bedding. Often, it's not that they don't care. Washing and changing linens is physically demanding, especially for someone with limited strength or joint pain. Some elderly individuals may even avoid disturbing their bed, seeing it as unnecessary work. But doctors understand how vital clean fabrics are for maintaining skin health and overall hygiene. They stress that even small steps, like having a caregiver assist with weekly laundry or using lightweight bedding, can make a significant difference. Nail and scalp care also stand out as areas where doctors quickly notice lapses. Long or dirty nails are not just unsightly, they can harbor bacteria that easily spread during eating or touching the face. Many older individuals can no longer see clearly enough to trim nails evenly, or they fear cutting themselves, so they let them grow unchecked. Doctors can spot this instantly: dirt buildup under nails, yellowing, or uneven edges that can scratch skin and cause infections. Similarly, scalp hygiene often declines because washing hair feels burdensome. Reaching overhead, rubbing shampoo, rinsing, and drying, it's exhausting for someone with limited mobility. Over time, doctors notice scalp buildup, dandruff, or even fungal infections, all easily preventable with proper care. But beneath all these visible issues lies something deeper: emotional and psychological decline. Doctors who have worked with elderly patients for years say that poor hygiene is rarely just about forgetfulness or physical difficulty. More often, it's a symptom of loneliness, depression, or fading willpower. When a person no longer feels that anyone will see or care about their appearance, motivation to maintain hygiene disappears. Some lose a spouse or live far from family, and without social interaction, they stop prioritizing self-care. Doctors recognize this pattern instantly: an unkempt appearance, a quiet tone, and avoidance of eye contact all signal emotional fatigue. Depression in older adults is often overlooked, but hygiene neglect is one of the earliest signs. The body follows the mind, and when the mind grows weary, cleanliness feels meaningless. Doctors also note how cognitive decline plays a major role. Elderly patients suffering from Alzheimer's or other forms of dementia may forget the steps involved in hygiene. They may not remember whether they've bathed or brushed their teeth, and confusion leads them to repeat or skip tasks entirely. Some may resist bathing altogether, not out of stubbornness but because they no longer understand why it's necessary. Medical professionals are trained to spot this behavior. They can see when hygiene neglect stems from cognitive impairment rather than laziness. In such cases, patience and structured routines become vital. Doctors often recommend visual reminders, labeled toiletries, or scheduled assistance to keep hygiene manageable without overwhelming the person. When hygiene declines, the consequences are not limited to the body. Social isolation deepens. An elderly person who smells unpleasant or feels embarrassed about their appearance starts avoiding gatherings, visits, and even doctor appointments. Doctors see this social withdrawal as a dangerous cycle. Isolation worsens depression, depression worsens hygiene, and the spiral continues. The challenge, they say, is to break that cycle with understanding and gentle encouragement rather than criticism. When elderly individuals feel respected and supported, they are more likely to resume caring for themselves. Medical professionals know that fixing these hygiene issues requires more than lectures or scolding. It takes a network of care, family involvement, caregiver support, and sometimes community programs designed specifically for seniors. Doctors advocate for practical changes that make hygiene easier and safer. Installing shower chairs, handheld sprayers, and non-slip mats can transform bathing from a fear into a comfort. Placing frequently used items like towels, soap, and toothbrushes at reachable levels reduces strain. Recommending electric toothbrushes, wide-handled combs, and easy closure clothing helps restore a sense of independence. Doctors often work hand in hand with occupational therapists to redesign routines that fit the abilities of aging bodies. In addition, they stress the importance of regular checkups, not just for physical health but for monitoring hygiene and mental well-being. When doctors notice consistent hygiene neglect, they often see it as an alarm bell, a sign that the elderly person may no longer be safe living entirely alone. It might mean they need daily check-ins, part-time help, or, in some cases, full-time care. Early intervention can prevent both medical complications and emotional decline. Doctors say the goal is always to preserve dignity, not to take it away. Providing help with hygiene should feel empowering, not humiliating. The connection between cleanliness and dignity cannot be overstated. Doctors have observed how a simple bath or a haircut can lift an elderly person's spirit dramatically. When someone feels clean and presentable, they stand taller, speak more confidently, and even eat and sleep better. Hygiene, for the elderly, is more than a routine, it's a form of emotional renewal. Doctors who witness these transformations often say it's one of the most rewarding parts of their work. It reminds them that healing doesn't always come from medicine, sometimes, it comes from care. For doctors, every case of hygiene neglect is both a warning and an opportunity. A warning that someone's independence may be slipping away, and an opportunity to restore hope and comfort. They look beyond the surface, past the smell, the stains, or the untrimmed nails, and see a person who once took pride in themselves, now struggling quietly against time. What they notice immediately, the world might overlook. But their attention to these small, human details often leads to interventions that save not just lives, but dignity. The shocking truth doctors share is that hygiene neglect among the elderly is almost never about carelessness. It's a mirror reflecting age's cruel trade-offs, strength for wisdom, independence for fragility. Yet, within those trade-offs, compassion and awareness can make all the difference. A clean body can restore confidence, reduce illness, and revive the will to live. What doctors see as a medical concern, they also recognize as a human need, the need to feel valued, clean, and cared for. And that, above all, is what they want every family to understand.